Hello and welcome back to Deep Knowledge Talk, the podcast where we rely on evidence and proven scientific research to dive deep into the most essential, emotional, and often misunderstood topics in the world of knowledge. Today, we're opening the second episode, Borderline Personality Disorder, also known as BPD.
That's right. And BPD, it's a condition that often carries a lot of emotional weight and, well, frankly, quite a bit of stigma, too. What really stands out is just the sheer intensity of emotion people experience and how often it's just misunderstood. You hear the term maybe in movies or TV.
Yeah, often not in a good way.
Exactly. And it feels like there's often this real fog around what BPD actually is.
Absolutely. It's not uncommon for it to be misdiagnosed either. And the way it gets portrayed sometimes, it can be really off, even harmful. Creates this image that just doesn't match reality for the folks living with it. And that's really why we wanted to dig into this today, for you listening.
Yeah.
Because underneath that stigma, there's a much deeper story, isn't there? Often one involving trauma, incredible resilience, and ultimately a lot of hope.
There really is. And, our understanding has evolved quite a bit. Even the name, borderline, has quite a backstory.
Whoa.
Yeah, back in 1938, a psychiatrist, Adolf Stern, he used it for patients who seemed to be, well, somewhere between neurosis, like anxiety and distress, and psychosis, which is more of a break with reality.
So kind of stuck in the middle, didn't fit neatly.
Pretty much, an in-between state. But that early idea was pretty broad. It wasn't super defined yet.
Right. So how did we get to a clearer picture?
Well, later on, the work of people like Otto Kernberg and John Gunderson was really key. They helped identify more specific patterns, in emotions and behavior.
Okay.
They really sharpened the clinical focus.
And that led to it being officially recognized.
Yep, in 1980. It was included in the DSM-3, the diagnostic manual. That was a big step, acknowledging it as a distinct condition.
Okay, so fast forward to today. How do we define BPD now? What are the sort of core features?
Fundamentally, BPD is seen as a personality disorder. The big things are chronic emotional instability, think really intense emotions that can shift very quickly.
Okay.
Alongside that, often a deep, deep fear of abandonment, and also a sense of self, like who you are, that can feel really unstable, changeable.
And you mentioned prevalence earlier. How common is it actually?
Estimates usually put it around 1% to 2% of the general population, which, might not sound huge.
But the impact.
Exactly. The impact on the person, their family, their relationships, it's profound.
Okay, so let's unpack the causes. What leads to someone developing BPD? Is it nature, nurture, or?
It's really a mix, a complex interplay. We definitely see biological and genetic links. Twin studies, for instance, suggest heritability might be around 40 to 50%.
Wow, that's quite significant.
It is. So there's clearly a genetic predisposition for some people.
But that's not the whole picture, right?
That's not at all. Environment, especially early life experiences, plays a massive role. Things like childhood trauma, emotional neglect, physical or sexual abuse. These are sadly much more common in the histories of people diagnosed with BPD.
That makes a lot of sense. Those early experiences shape so much about emotional regulation and relationships. You also mentioned brain differences.
Yes, research points to some patterns, like often there's increased activity in the amygdala, that's the brain's emotion center, especially for things like fear and anger.
Okay, the emotion dial turned up.
Kind of. And at the same time, there can be underactivity in the prefrontal cortex. That's the part involved in planning, decision-making, and crucially, putting the brakes on emotions and impulses.
So high emotional sensitivity combined with maybe less effective emotional control.
That's a good way to put it. And then there's this other really important piece, the concept of an invalidating environment.
What does that mean exactly?
It's usually in childhood, where a person's feelings are consistently dismissed, ignored, punished, or just fundamentally misunderstood by caregivers.
Oof. Like being told you're too sensitive or stop crying all the time.
Exactly. Or maybe your genuine distress is just completely ignored. Over time, the child learns essentially that their internal world is wrong, or doesn't matter, or doesn't make sense to others.
That sounds incredibly damaging.
It really can be. And this ties into what's called the biosocial model.
Okay.
It suggests BPD often arises when someone with that biological vulnerability, that heightened emotional sensitivity we talked about, grows up in that kind of invalidating environment. It's the interaction between the person's temperament and their environment that leads to these patterns developing.
That provides a much richer understanding. So let's shift to symptoms. How is BPD actually diagnosed? What do clinicians look for in you, the patient?
Okay, so diagnosis uses the criteria in the DSM-5. A person generally needs to meet at least 5 out of 9 specific symptoms.
5 out of 9. Okay, what are they?
All right. First, frantic efforts to avoid real or imagined abandonment. Huge fear there. Second, a pattern of unstable and intense relationships. This often involves swinging between extremes, like idealizing someone one minute,
Seeing them as perfect.
and then devaluing them, seeing them as terrible the next,
Yep.
often triggered by small things.
Got it. What's third?
Third is an unstable self-image or sense of self, just not having a clear, consistent feeling of who you are. Fourth, impulsivity in at least 2 areas that could be damaging things like spending, sex, substance use, reckless driving, binge eating.
Risky behaviors.
Yes. Fifth is recurrent suicidal behavior, gestures, threats, or self-harming behavior.
Okay.
Sixth, what's called affective instability, basically, really intense mood swings happening quickly. Seventh, chronic feelings of emptiness, just a persistent inner void. Eighth, intense, inappropriate anger or difficulty controlling anger. And ninth, under stress, sometimes experiencing transient paranoia or severe dissociation, feeling disconnected from reality or yourself.
Wow, that's a lot. And needing 5 means it could look quite different from person to person.
Absolutely, that's a key point. 2 people with BPD might share only a few symptoms but still meet the criteria. It makes it complex.
You mentioned mood swings. I think a lot of people might confuse BPD with bipolar disorder because of that. What's the key difference there for our listeners?
That's a really common confusion. A key difference is often the duration and trigger of the mood shifts. In bipolar disorder, mood episodes, mania, hypomania, depression tend to last for days, weeks, sometimes months.
Longer periods.
Yes, and often seem to have a stronger biological rhythm. In BPD, the mood shifts are typically much faster. We're talking hours, sometimes even minutes. And they're very often triggered by interpersonal events.
Like an argument or feeling slighted.
Exactly. A perceived rejection, a fear related to a relationship. It can spark a really intense, rapid emotional shift. It's more reactive to the immediate environment.
Okay, so less of those prolonged highs and lows, more like these sudden emotional storms triggered by interactions.
Precisely. Let's maybe take an example. Think of someone we'll call Sarah. Say her friend doesn't text back right away. For Sarah, with BPD, that might trigger this overwhelming wave of panic, this intense fear her friend hates her or is leaving her. The reaction may be intense anger, maybe self-harm. It isn't manipulation. It's driven by unbearable emotional pain from that perceived abandonment.
That's so important to understand. It's about the internal pain, not an attempt to control.
Exactly. Or consider Alix, who meets someone new and instantly thinks they're the most amazing person ever, totally perfect.
Idealization.
Right. But then, the first time that person does something slightly disappointing, Alix might suddenly flip, seeing them as fundamentally flawed, untrustworthy. Devaluation.
That quick switch.
It's less about Alix being fickle and more about the difficulty holding on to both positive and negative feelings about someone at the same time. It's hard to integrate those extremes into a balanced view.
It just sounds exhausting. Experiencing emotions that intensely, that quickly. You can see how challenging that would be, both for the person and for those around them.
It absolutely is. The intensity is overwhelming. But recognizing this is the disorder, not, bad behavior, is crucial for breaking cycles of misunderstanding.
So if someone listening or someone they know relates to this, what help is available? Is BPD treatable?
Yes, absolutely. And this is such a critical message. Despite some old pessimistic views, BPD is highly treatable. There's been huge progress in therapies that really work.
That's great news. What kind of therapies are we talking?
One of the best known is dialectical behavior therapy, or DBT. It's very skills-focused.
Skills? Like what?
It teaches skills in 4 main areas: mindfulness, being present; emotional regulation, learning to manage those intense feelings; distress tolerance, coping with crises without making things worse; and interpersonal effectiveness, navigating relationships more smoothly.
Wow, that sounds incredibly practical. A real toolkit.
It really is. DBT gives people concrete strategies. Then there's also mentalization-based therapy, MBT. Yeah, it focuses on improving your ability to mentalize, basically, to understand your own mental states, like thoughts and feelings, and also to understand the mental states of others, why people do what they do.
So understanding intentions and emotions better, both yours and theirs, could really help with those interpersonal triggers.
Precisely. It helps reduce misunderstandings and manage relationship difficulties. Another one is schema therapy.
Okay.
This one goes a bit deeper into early maladaptive schemas. These are like deeply ingrained negative beliefs about yourself or the world, often stemming from those early difficult experiences we talked about.
Like I'm unlovable, or people always leave.
Exactly, those kinds of core beliefs. Schema therapy helps you identify them, understand their origins, and start challenging and changing them, developing healthier coping mechanisms.
Getting to the roots.
Right. And there's also transference-focused psychotherapy, TFP. It's more psychodynamic, looking at the emotional patterns that show up in the relationship between the patient and the therapist.
Using the therapy relationship itself as a way to understand broader patterns.
Exactly. By exploring those dynamics safely in therapy, you gain insight into how you relate to others outside therapy.
So it seems like there are several really solid evidence-based options. What about medication? Does that play a role?
It can. There's no specific BTD pill that cures it, but medication can be helpful for managing co-occurring issues that often come along with BPD, things like severe anxiety, depression, maybe sleep problems.
So more for managing related symptoms than the core BPD itself.
Generally, yes. It's usually an adjunct, something used alongside therapy, which is really considered the main treatment.
Got it. Therapy is key. And what about the long term? Is lasting recovery really possible for you listening?
Yes, and this is where the story gets really hopeful. Long-term studies show remarkable rates of improvement. Some studies suggest up to 85% of people diagnosed with BPD achieve full remission of symptoms over time.
85%, that's amazing.
It really is, especially with consistent therapy and support. Recovery is not just possible, it's probable for many. People can and do build fulfilling lives.
That completely counters the old idea that it was a lifelong, untreatable sentence.
It absolutely does. It underscores how vital access to good, sustained treatment and support systems are.
Okay, let's circle back to something we touched on at the start. Media portrayals and those common misconceptions you might encounter.
Yeah, this is so important. Unfortunately, popular culture often falls back on really damaging stereotypes. You see BPD represented as inherently manipulative, dangerously unstable. The crazy ex trope is sadly common.
Right, that caricature.
And it's not accurate, and it's incredibly harmful. It fuels stigma, makes people afraid to seek help, afraid to disclose their diagnosis.
But what's the reality behind that stereotype? What should people understand?
The reality is that individuals with BPD are often incredibly empathetic people. They can be highly creative, very passionate, and show amazing resilience dealing with overwhelming emotional pain. Their struggles often come from a deep need for connection, coupled with that intense sensitivity to rejection.
That paints a very different picture. And there's also that myth about it mostly affecting women, right?
Yes, that's a big one for you to know about. While women are diagnosed more often, current thinking is that this might be less about actual prevalence and more about underdiagnosis in men.
How so?
While stigma and gender biases play a role, how symptoms are expressed and perceived, a man experiencing intense emotional dysregulation might present with more externalized anger or substance use, perhaps.
And get diagnosed with something else, or just labeled as difficult.
Potentially, yes, rather than recognizing the underlying BPD pattern. So men might be missed or misdiagnosed more often.
So it affects everyone, but diagnosis rates might be skewed by societal factors.
That seems likely. Ultimately, tackling stigma for everyone really starts with education, with understanding the complexity, acknowledging the real pain involved.
And just approaching it with compassion instead of judgment.
Exactly. Moving past those harmful stereotypes and seeing the person, seeing their potential for recovery.
Well, this has been incredibly insightful. We've really unpacked a lot today, the history, the causes, those intense symptoms, and crucially, the effective treatments and the very real hope for recovery.
Yes, it feels vital to get that message across. BPD is treatable. Recovery happens.
And shifting our perspective, moving beyond those damaging myths towards compassion and understanding, that helps everyone involved.
It truly does. It helps the individuals, their families, and ultimately makes our communities more supportive places.
Thank you. If this episode helped you, please join us next time as we continue exploring the stories behind the science.